Hello and welcome to the podcast. In this episode, I want to talk about RFK Jr. You may think that his appointment or potential appointment, if ratified by the Senate, doesn't affect you, but I would suggest that in some ways it could, and I will explain. So let's look at this headline to begin. What RFK Jr. could do on US vaccines, fluoride and drugs. President-elect Donald Trump has announced he wants to appoint vaccine skeptic Robert F. Kennedy Jr. as the head of the US Department of Health and Human Services. Why is that important? Well, let me take you back in time a little bit and let's look at the latest, hopefully the last, but probably not, pandemic, in particular the response to it. Let's begin by looking at one of the main players in that response, Pfizer. Here's what Albert Bourla had to say about using the mRNA approach as opposed to a different approach.
A little into the weeds here and the mRNA technology. When you and your colleagues were trying to decide which route to go down, the traditional vaccine route or the mRNA route, you write that it was, quote, most counterintuitive to go the mRNA route, and yet you went that route. Explain why.
It was counterintuitive because Pfizer was mastering, or let's say we had very good experience and expertise with multiple technologies that could give a vaccine. Adenoviruses, that some of the other vaccines are. We were very good in doing that. Protein vaccines, we were very good in doing that, and plus many other technologies. mRNA was the technology that we had less experience, only 2 years working on this. And actually, mRNA was the technology that never delivered a single product until that day. Not vaccine, not any other medicine. So it was very counterintuitive, and I was surprised when they suggested to me that this is the way to go. And I questioned it, and I asked them to justify, how can you say something like that? But they came and they were very, very convinced that this is the right way to go. They felt that the 2 years of work on mRNA since 2018, together with BioNTech, to develop a flu vaccine, made them believe that the technology is mature and we are at the cusp of delivering a product. So they convinced me. I follow my instinct that they know what they are saying. They're very good. And we made this very difficult decision at that time.
Now, it struck me as being very odd at the time that Albert's response was, well, it was suggested and, I was kind of convinced. It's all about woolly. He says, I use my instinct. Better to use your intuition, Albert. You hadn't tested this on anybody, it would seem. This particular approach, this mRNA approach, hadn't been used. Why use it at the start of something that was also unknown? This COVID-19 virus, what was it? Where did it come from? Oh, I tell you what, we don't know any of that, so let's just use this approach that we don't really quite know how it will pan out. How do I know that? Well, we'll come on to that in a little while. Let's skip now to Dr. John Campbell, who is someone who's a medical professional, has taught in medicine for many years. And here's what he says about something called aspiration.
Germany have just amended their administration techniques for the vaccine to include aspiration, drawing back on the needle to make sure we're not in a blood vessel, following what they're doing in Denmark. In the United Kingdom, the United States, Canada, Australia, New Zealand, we're not doing that. So in my view, all those countries are doing it wrong. So if you live in any of those countries, please forward this along to your elected political representative, because we need to get it changed. Now, I'm going to give you the full evidence for this. If you don't want to post them the video, just post them the links that I'm going to post below with the evidence in.
Now, what's the link between that and Albert Bourla? Well, like I said, this mRNA approach was new, brand new, and there was still so much to be known about this virus and how to respond to it and how deadly or not it was. And his contention, John's contention, and the contention of others as well, he's not alone in this, is that one of the vaccine injury causes was because a blood vessel was being hit. So if you aspirate, if you draw back and you see some blood, then you're probably in a blood vessel. So choose a different site. So agitated was he that he wrote to the then vaccines minister. And here, well, let him tell you.
Now, I've shown you my letter. I felt strongly about this, so I wrote to Nadeem. Well, I wrote to my MP, and he passed it on to Nadeem Sahawi, of course, our vaccine minister in the UK. So it tells me I can go there for further information, which of course is nice. From reports of major thrombosis with concurrent thrombocytopenia, we have not been able to identify any evidence associated with errors in administration in UK cases. Well, of course not, because you don't know. If it's gone into a vessel and you inject, you don't know you've done it wrong. Of course there's no evidence. It's ridiculous. Quite ridiculous. The very rare clotting condition reported, well, it is probably about 1 in 85,000, but that's been enough to discredit the vaccination programme. This is why this is so massively important. Reported following the administration of the University of Oxford AstraZeneca COVID-19 vaccine is thought to be due to an immunological mechanism. Well, here we see it's an immunological mechanism combined that occurs after inadvertent intravenous administration, but not after correct intramuscular administration. Right, where am I? Guidance published by Public Health England says this. It actually says there is no need to pull back on the plunger to aspirate before the plunger is depressed to release the vaccine into the muscle because there are no large vessels in the recommended injection sites. Now, this is Nadeem Sahawi, the vaccine minister. Look at it. It says there are no large blood vessels at the recommended injection site. So firstly, he doesn't know that it's not being done right. Then he says there's no large blood vessels. Is that true? Well, when you want to know about anatomy, you get this book out, Gray's Anatomy, 41st edition, which I think is still the latest edition. And you look up the relevant section. This is where you go for your anatomy definitive text. And then you look at the relevant diagram. And here we see one. So here we see the deltoid muscle around here. This is high up in the deltoid muscle, but here we see this bundle, and these dots are arteries and veins. And anatomical variations means that these could sometimes go down further. So Nadeem Sahawi's letter says this: there is no need to pull back on the plunger, aspirate before the plunger is depressed to release the vaccine into the muscle because there are no large blood vessels at the recommended injection site. No, that's what he says. But I've just shown you Gray's Anatomy points them out.
The vaccine minister is saying, oh, there's nothing to worry about. In that earlier clip, you would see John Campbell talking about Germany using aspiration following Denmark, but not in the UK, not in other countries. So what we were getting was not clear cut. Now, let me interject at this point and say, as I've said before, it's fair enough to sit and look at things through the lens of time with that particular hindsight and say, well, I would have done things differently. I totally appreciate that the governments were under pressure. The UK, the US government, other governments were all under pressure. They didn't know what to do, and they erred on the side of caution. But my contention here is that we got very little in terms of different opinions, any real debate. A lot of it tended to be quashed. There was quite a bit of propaganda about it. We'll come on to that as well. because it was quashed, it felt one-sided. Some people, like me, felt uneasy. Something wasn't quite right. People were not being given all the facts, all the perspectives. And I don't like that. And I do not think that that is right at all. Initially, yes. Initially, well, I would have closed the borders right away. They remained open, which always puzzled me. And indeed, was it not a case, was it Real Madrid supporters came flooded into Liverpool for a football match, a soccer match, if you're in the States? Why was that? What, really? Why did you do that? Governments, of course, can be very complicated, complex, bureaucratic, and it's easy, again, through hindsight, to say, hey, I wouldn't have done that. But I'm going to say it anyway, I wouldn't have done that. That didn't seem logical. So, having said that, let's then look at perhaps some of the subtlety. Because Sweden kept the schools open. They didn't close the schools, unlike they did in the UK and a lot of other countries. This article begins, Sweden kept schools open during COVID. Here's what happened to the children. Did Sweden's pandemic strategy really result in happier, healthier kids? Christina Hopkinson speaks to Scandinavian families about their experiences. And I'll skip on in the article. Premature aging of adolescent brains, myopia, chronic school absenteeism, a dramatic rise in mental health issues like eating disorders, a third of years lost learning. New evidence emerges daily of the toll that COVID school closures have had on children in the UK and across the world. And I will say up front that I thought they should have been opened. Like the borders should have been closed, and then maybe we should have looked at the restrictions, particularly when considering who was actually at risk. There seemed to be no flexibility. The lockdowns continued. There wasn't a measured response, which I think would have helped a lot of people, and it would have protected those who were actually vulnerable. But we'll come on to that for the moment. Let me continue with this article, because I want to introduce, or I want to go far enough in this article to allow you to consider the subtlety of it as well. I don't want anything to be clear cut here, because I don't think it is clear cut. However, the messages that we were getting a little while ago, not too long ago, were apparently very clear cut. Here's what you do, and do that and everything will be fine. Anyway, let me get back to the article. The COVID inquiry is to examine the impact of the pandemic on young people, with former Education Secretary Gavin Williamson to be questioned. And I'll skip to another part of the article. Sweden is a country that is perceived to have done just that. In other words, protected the children, or protected the children better than some other countries did. Admired by lockdown skeptics, it's famed as a place where restaurants and most schools stayed open and people made their own decisions about the risks they were willing to take. And I think that's important. They made their own decisions. They were treated as if they could think. And then here, and Sweden has by no means swerved the mental health crisis gripping teenagers here in Britain. So like I said, I want to be balanced with this, which is the point. It is the key. Part of Sweden's strategy was to balance the risk of dying from COVID with the risk of dying from the effects of lockdown on the economy and other aspects of healthcare. A better measure of this is in looking at excess deaths over the period 2020 to 2022. In this, Sweden excels. Arguably fewer excess deaths than any other European country, and half those of the US. Mark Woolhouse is a professor of epidemiology at the University of Edinburgh, government advisor and author of The Year the World Went Mad about the pandemic. That's a very good title. He believes Britain could and should have reopened schools much sooner. At the start of the pandemic in March 2020, he says, you could justify the decision because of uncertainties around the COVID risk to children, the risk to staff, and the contribution that schools might make to the transmission of the virus. Absolutely, exactly that. And I think most people would agree. And I'm certainly not disagreeing. That's my point. But there was a lack of subtlety, and there was a lack of involvement and conversation, proper conversation and debate that people could listen to and make some decisions for themselves, be allowed to make some decisions for themselves. But continuing, he says, it was soon apparent that there was very little evidence of those three effects from anywhere in the world. In other words, children were neither badly affected by COVID nor acted as vectors for the disease. There was very little benefit in closing schools and little thought given to the obvious costs. In the government meetings I went to, there was lip service paid to the idea that closing schools was a bad idea for the kids, but no more than that. He argues that we could have done as Denmark did and reopened schools in April 2020. And I remember talking about this, and I think I actually posted something online, and a friend who I thought would have known better was pretty much on the attack about it. Why was that? An intelligent individual, but they were scared and they were buying into the constant messaging that we were getting from the government. That when you began to think about it, particularly as things went on, it didn't make any sense. It was too one-sided, it was too biased, it was too simplistic, and of course other places were doing things differently. Anyway, let's look at this. Chris Whitty left with another difficult patient after JCVI rejects COVID jabs for 12 to 15-year-olds. You may recall this. Ministers are determined to push ahead. They believe vaccinating secondary school pupils could mitigate the impact of children working without masks or class bubbles this autumn. Vaccines for teenagers and booster jabs for older people need to start soon if they are to have the greatest chance of fighting infections this winter. So the decision now gets bounced to Professor Whitty in England and to his counterparts in the devolved nations. He is under pressure from Number 10 and Health Secretary Sajid Javid, remember him, to give the green light. The Joint Committee on Vaccination and Immunisation, JCVI, the aforementioned, were obviously not recommending that children 12 to 15-year-olds should be vaccinated. But ministers want to push ahead. Why? What was going on? Again, that one really annoyed me. I thought that was dreadful. As an aside, I do believe I read that in the States, probably around about the same time, Dr. Anthony Fauci wanted to be injecting 6-month-old babies. Anyway, you'll see here, COVID vaccines to be offered to 12 to 15-year-olds, chief medics decide. So a bit of a fudge. It wasn't pushed that strongly, but it was offered. So kind of a light recommendation. But according to that committee, the Vaccination and Immunisation Committee, there was no need. So once more, what was going on? Then let me go here to this other way one could look at things have been given a more nuanced perspective and also approach. You see here that the title from the BMJ is COVID-19 Group of UK and US Experts Argues for Focused Protection Instead of Lockdowns. So continuing with that article, the authors were Jay Bhattacharya, Professor of Medicine and Economics at Stanford. Then we had Sunetra Gupta, Professor of Theoretical Epidemiology at Oxford, and Martin Kulldorff, Professor of Medicine at Harvard. So total lightweights, obviously. And he said because older people were 1,000 times more likely to die from COVID than younger people, an age-stratified approach could allow resources to be focused on older and high-risk patients, while allowing younger and healthier people to attend school and keep businesses open. Now, you may or may not recall, but this was called the Great Barrington Declaration, and it kind of got sidelined. when these people spoke out, well, they didn't get much airtime. And I remember that Jay from Stanford, I saw a video where he was talking about how he was kind of vilified. Now, these people are extremely smart, and I would have thought they would have been front and centre of, well, governmental responses and approaches to this. But instead they weren't. And I want to get back to RFK Jr. Before we do that, let me show you something else.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
So was the Pfizer COVID-19 vaccination tested in terms of stopping transmission before it entered the market? The answer to that, as I kept on telling people, was no. Obviously it was no. But you may be surprised when you saw that video, and you're surprised right now perhaps if you've never seen it before, although you may have heard of it. What was your impression from the media? Wasn't it not only safe and effective, but it would protect other people because it stopped transmission? You could argue if you didn't get COVID-19, or perhaps the viral load was much lower, then maybe it would reduce it. But the implication, as I recall, and several other people that I've spoken to, was that, well, if you took it, then it kind of would stop things. It would stop it transmitting. It would stop you transmitting that virus. And the reason I was saying this is nonsense is because they didn't have time. They had no time to test it. You need time to do that. What am I getting at then? I'm getting at RFK Jr. will disrupt. He will disrupt. Now, hopefully that disruption will all be beneficial. But fear not, because if it is so far out there, then there are other people around in Congress and within the Republican Party, and possibly Trump himself, who would say, no, that's way out there. RFK Jr. is not unintelligent. He's highly intelligent. Eccentric, yes, but is that a bad thing? Sometimes that leads to creative solutions. Very often it does. So let's see. But please don't presume, because he appears to be so different, that he could disrupt things in a bad way. Because I think things do need disrupted. If you think that companies like Pfizer are squeaky clean, then please think again. I'll point you to some things in the past. And why mRNA? I'm still confused about that. And another way that RFK Jr. may bust things in a productive way, in a constructive way, is because he could tackle some of that propaganda. And we saw a boatload of it. We're still seeing it in all sorts of different areas. We saw it with these campaigns on both sides. I've already talked more than once about the campaign that was run by Kamala, and how much of that was just smoke and mirrors. But of course, Trump's not immune from that particular predilection either. However, the propaganda that we have been getting these last few years, I believe, has been outrageous. And let me point you to a couple of videos.
Will they still take my temp at the door? Shout out to our favorite MD, Anthony Fauci.
Welcome to the Hunger Games. Now, that's cringe-making as far as I'm concerned.